Welcome back. Well, it looks like teens are now getting the green light for vaccination. The FDA granting emergency use authorization to Pfizer and their vaccine in 12 to 15-year-olds. So let's chat more about this and more in the coronavirus pandemic. We've got Dr. Andre Campbell joining us now. He's a professor of surgery at UCSF and an ICU physician and trauma surgeon at the Zuckerberg San Francisco General Hospital. So, doctor, let's start with that emergency use authorization for Pfizer and their vaccine. Curious to know how much this could make a dent once we start getting teens starting to get vaccinated in addition to adults.
Well, first of all, thank you for having me today. I really appreciate it. It is really great news that this emergency use authorization has been given for teenagers from 12 to 15. The study showed that in the group that got it, they had no infections. The other group had upwards of 16 infections. So it was proven to be very safe and efficacious with respect to giving it. So I think this is great news. It automatically opens up 30 to 40 million more people as we begin to try to move towards herd immunity, which is that number we think about 70% of the population or so to get vaccinated so they could be resistant. But it is actually wonderful news. We're really quite heartened in the medical community that now it's being opened up, because what does it mean? It means schools can open up, more safely. The kids will be vaccinated better, and that we can look for things in a positive light now, as opposed to what it has been over the last couple of months where we've had mainly bad news. That's good news.
Doctor, I'd love to get your take on something the Novavax CEO shared with Yahoo Finance earlier today. He was on with our health reporter, Anjali Kamlani, and he shared his thoughts on giving up his company's, or possibly giving up, I should say, his company's intellectual property. Take a listen to this.
It doesn't work to just send out your IP and people can't duplicate what we do. It would take years to do that. What we've done, we've accomplished that by licensing our product in 4 different continents already.
And of course, Stanley Erck, the CEO of Novavax, was talking about the Biden administration considering lifting the patents that these big pharma companies have on the COVID-19 vaccine so it could be more widely distributed around the globe. What is your feeling on that? I mean, certainly these are for-profit companies at the end of the day, Doctor. Should they be able to hold on to their intellectual property here, do you think?
Well, I would tell you one thing from the medical point of view. To me, it makes sense, because the more vaccines we can make, the better it is. This is a global pandemic. I mean, we're struggling in the United States with trying to get people who may be vaccine hesitant or not. But look at what's happening in India. India is a really big disaster. This is a global pandemic. Brazil, it's also a big problem. So anything we can do to get this information out so that other companies can do it is fine. Now, my understanding from what I have heard regarding this issue regarding the patent is that it will take time for these other companies to get up and running, so that it may work, but it'll work in 2022, which we need this right now. I mean, what's going on in India is terrible. There's a triple mutant that's running through the population, and it is something that we need to focus our attention on, the fact that we're trying to get things under control. Things are looking better here, but this is a worldwide problem. There are places where they've only given out 300 vaccines that got millions of people. So we have to start looking at things from a global point of view, because this is a global pandemic. This is not just us in the United States, the richest country in the world, that we have more resources. We need to make sure we look at things from a global point of view. And this is a good thing, I think, in my opinion.
So to that point, doctor, those variants that you just mentioned, those mutations, curious to know, as a part of this fight on a global level, how much will booster shots, do you think, be a part of that? I mean, as a medical professional, you obviously had access and the ability to get a vaccine much sooner than the general population. Are you hearing now that you might need a booster shot yourself? Is that something that you are all in the medical community anticipating will be needed, not just to continue to fight the coronavirus pandemic, but really to make sure that everyone is inoculated against those mutations, those variants?
Yeah, I think that's a really good question, because I was fortunate. I got a vaccine early because, I'm a little bit more at risk than other folks because, I walk up to patients and they may have it, and we want to make sure that we protect our healthcare workers because there's been thousands of healthcare workers who have died. But there's been discussions that, you may need to have a yearly booster. I mean, Pfizer's actually working on what a booster shot would look like, taking in these variants. Remember, these viruses are built to mutate. That's what they do, right? The more they spread, the faster they spread, that they will mutate. Now, that's what concerns me in this country is that we have some states where we have 30% people vaccinated. We have other states where we have 70% of people vaccinated. And the problem is we're one country and people travel all over the place. So if we're going to make sure everything is safe and not have these pockets, sort of flare-ups where people happen in Michigan, happen in Louisiana, happen in Mississippi, we need to really kind of make sure that we get as many people vaccinated as possible, making it easy. So you walk down the corner to CVS, Walgreens, any place, you get a vaccine. And we have to make it really easy because we're now into the group of people who are really saying, well, maybe it's not so safe. And I'm like, okay, we've given 200 million injections of this, and it is actually very safe, much safer than many other things that we give. So the point of the matter is that let's get everybody vaccinated. And yes, we're going to probably need a booster, and it's okay. It doesn't hurt that bad.
That is what I'm hearing. Doesn't hurt too bad, but a very good reminder that those vaccines absolutely are safe. Dr. Andre Campbell, professor of surgery at UCSF, of course, trauma surgeon over at Zuckerberg San Francisco General Hospital. Thank you so much for joining us today.